Hi there, I'm Lyndsey.
Hi, I'm Rod.
And this is Kiara. Kiara is now almost 5 weeks old, and she's doing really well. I think we've been pretty lucky, but we've also prepared ourselves to make sure that we had the best opportunity to make sure that we could get some sleep and we could understand what was going on in Kiara's early days by going to Julie's transition to parenting course. I guess when I first became pregnant, I was very ready. We were very ready to have a child. I'm 36, and you kind of think everyone's done it before. It can't be that hard, and then you realize, I have no skills in changing a nappy. I knew I'd never change a nappy. I've never changed a nappy, and I knew I'd have the first opportunity with my own child. So realizing, there are a few things we need to prep up on and learn about. So we did a hospital antenatal class, which gives you a bit of limited information, a bit of the basics, I suppose. So we decided that we should probably, and I went to a physiotherapist who actually recommended, things I wanted to understand about my body. She said people had had a better experience of labour because they'd gone to Julie Clarke's course in Sylvania here, and they had, because they understood what was actually going on in their body through labour, they'd actually had a better experience, which made me prick up my ears and think, well, isn't labour just about delivering a baby, as Rod would do? That idea of understanding what was going on in my body really intrigued me as to looking into what the courses were about. And it just so happened in the same week, an ex-colleague said to me that she had done Julie's course. So again, my ears pricked up, and I decided to look online at what it was about.
Well, she actually made a comment and said that it was very helpful for her partner.
That's right.
That's the main reason she recommended it. Thought it'd be good for me.
I think I was a bit worried about recommending it to you, coming to you and saying, look, can we do this course, because I know that you're not very keen on classroom environments.
It didn't end up being a classroom environment. It was more like a lounge sort of area, and we had a few jokes, and it was an easygoing sort of course, so it wasn't like a major test or exam you had to go for or anything. So
actually, Julie, I remember the first session with Julie and thinking, when is the course actually starting? Because it just seemed to kick off with a discussion and a chat, and it was really informal, really relaxed. You were able to go and have tea and coffee and sweets or just minties and nutritious snacks outside. So really, really relaxed atmosphere. And I was really grateful that Rod was actually keen to do this sort of classroom environment learning, because I really felt a benefit, especially through labour, knowing that Rod had the information that he'd learnt from the course made my experience of labour so much better, because I myself couldn't have asked for the things that you did for me.
Yeah, I actually had the booklet I was given from Julie's class, and I was giving Lyndsey a massage as you do in some of the information. I was reading at what stage we were at, and felt much more relaxed knowing that we knew what was going on, and I didn't feel stressed or anything like that. And I think it increased the sort of speed of the labour, where I think if being stressed, Lyndsey would have tightened up, and things would have been
I think
a bit slower. And
knowing that it wasn't all just about me, and that you understood and you were there to support, because I think in the past, we've discussed labour, and you'd felt, or I knew that you felt that you didn't want to see me in pain, but the changing the idea that you're there to support me rather than to worry about me being in pain was great as well. And I couldn't have asked for a better birthing partner, and I think you learn all the things, putting a flannel on my forehead, putting a wet flannel on my back. It went so quick for me that I couldn't have even thought about them. That's all I remember about it, was just Rod being so proactive, being able to offer me water, offer me a red frog, offer me soup, chicken broth. That was an amazing tip that Julie gave us, was to take in some chicken soup, because I hadn't had a chance to have lunch. We didn't really expect that we'd be going into hospital for an antenatal appointment the day before I was due, and having contractions that morning. I didn't actually expect that they would keep us in. They did originally say, we'll send you home. Contractions were about 6 to 8 minutes apart, moderate, bearable, a bit like period pain, but quite intense. And I remember seeing all the girls in my antenatal hospital class all there, and they were asking, what does it feel like? So, trying to stay around the corner, not sure it was as painful as it might have been. And then my blood pressure was a little bit high, so they sent me up to assessment unit, and they basically said, you're going to stay because you're 4 centimeters dilated and you're ready to have a baby. And knowing all that and feeling like, oh, that didn't seem too bad, having spent the morning actually in front of my computer and still working, and going through the contractions because I knew what was going on, because I knew what my body was doing, the cervix thinning, getting ready for labour. That was all something I'd learned through Julie's course, and again reminded me of what the physio had said, that you have a better experience if you know what your body's doing. So the labour was much more bearable. I think having the knowledge that we had and ability to ask the right questions, because again that was something for me. I think I just thought, well, they're the experts, the doctors, the midwives, they're experts, they'll tell us what we need to do. But knowing that you can actually ask the right questions, that you have choices, that was again something we learnt from Julie's course, and having that information, able to understand the consequences of the different choices, meant that we were able to put together our own birth preferences as well. And luckily at Sutherland Hospital they were really supportive of those birth preferences. They actually asked for them when I went in. Had the time to print them off luckily before we went in, and they tried to stick to them as best they could.
Yeah, well, I think we wouldn't have even known what choices we would have had unless we'd done the course. So
yeah, that's true.
Actually understanding what was going on and what we were told, and how things were happening, was a lot more helpful, and we weren't stressed at all. Actually,
I think people talk about having a birth plan, and I remember wondering what exactly is a birth plan. You join Facebook forums and they talk about birth plans. You think, don't you just want to deliver the baby? But then realizing what you can actually put in a birth plan, because Julie's coursework was, exactly the questions you need to consider, gave you the ability to actually write your birth plan step by step. You could make it as comprehensive for you as you wanted, reminding yourself what to look out for in terms of contractions, when to call the hospital, but then what was relevant to pass on to the midwives when you go into the labour delivery suite. And it didn't have to be an essay, it was just the important things.
And knowing what to pack and to take with you, it was quite helpful.
Very. Yeah, I felt we were very prepared, and it was really relaxed because we were prepped for it through the course. And even afterwards, you're still looking at the books. Now I'm still looking at the books to look at how to manage an episiotomy, because I had to have an episiotomy because although I was fully dilated, her heart rate was dropping, and the doctors came rushing in doing the episiotomy. I believe they went out to go and get forceps and vacuum to speed the process up, and at that point the midwives all closed in and said, come on, you can do this, you can push the baby out, we can see her, you can do this. And that was great, knowing that even though the doctors hadn't said that they were going to get the instruments, I knew that's what was happening, because I understood that was the process from the courses. And having subsequently spoken to the midwife to clarify, I chatted to her and said, okay, so what exactly happened? Because it was all a bit of a blur for me, knowing when I could hear them say, you can do this, you can push this baby out. I knew it was my cue that if I want to continue having the birth that I had gone into to preferred to have, that's what I needed to do, and it was great. Managed to do it. So I think the doctors came back in and got a bit of a surprise. They weren't needed.
Yeah, I think the information for after the birth too was helpful. So we even still look back to the information, so we know where she's at, and still look into it in the next few months.
Girls from my antenatal course as well at the hospital, you know, have subsequently had their babies. We chat about what the difficulties we're having with our babies, and I often find I can share information with them that they don't know about. And you know, I'm looking at Julie's book and how to deal with colic, or how to deal with, you know, your episiotomy stitches, and ensure that there's no infection, how to manage them. I've been able to share some of that information with the girls, and they've not been aware of it before. So knowing that, you realise, you know, the information that I have from the Transition to Parenthood course puts me in a lot better position, makes me a lot more confident, made me a lot more confident from going from pregnancy through the birth and now into early parenthood. And it makes you realise that things are normal. Things, you're prepared for the things that are happening. You know that it's normal what's happening. You don't stress because the information has been given to us, because we sought that knowledge. One thing I think in the first couple of days, you know, I remember talking to Julie about engorgement, always saying, oh yeah, I want big boobs. And Julie, you know, she reminded me, she said, you know, engorgement, yes, big boobs, but actually, you know, there's a lot of hormones going on. You know, you've got to be prepared for the postnatal depression, the thoughts, the risk there. And I remember being aware of that and knowing that that was going to happen, or that could happen. I suppose made me more aware, and made me responsive to what I was feeling, and trying to overcome it with other things that I could think about, that I could be grateful for. The fact that I was able to rely on Rod as well. Luckily for me, Rod wasn't going back to work, so he's off with me permanently, I suppose, as long as we choose to be not working. So he didn't have to rush back after 2 weeks of parental leave straight back to work. And it made us realise how difficult it must be for a lot of people, a lot of women, who have to deal with a partner heading back to work so soon.
Yeah, I don't think 2 weeks is long enough. Yeah.
No. Yeah, I'd highly recommend if you can get more time off.
4 or 6 weeks would be be a lot easier.
And I only had episiotomy stitches. Imagine all the ladies who have to deal with cesarean. Must be a lot harder. And then I had my mum coming out from the UK when Kiara was 2 weeks old. So I had a lot to look forward to and keep me on track from not suffering the postnatal depression and the baby blues, as they call it, at day 3, day 4, when your boobs come in and are all engorged. And I suppose I kind of liked that they were a bit bigger. I didn't get the worries and the baby blues. Although I was aware of it. I could feel it. I was just making sure I was grateful for the things that I could be grateful for, and that was Rod being very supportive. And I think that came from the course as well.
I think you made that 10 minutes longer.